Hello, I wanted to give an update today, really in answer to a question that I've had a few times from folks, and that is, hey, why haven't we closed a school when there's been a case, when you see in the paper that other districts around us have closed schools for just a couple of cases? So I want to go through the process, give you some numbers, let you know where we are with that. First of all, when we have a confirmed case and we wait for the Health Bureau to confirm it for us, then there are two key questions that we ask. The first question is, where did that person get infected? And in every case so far, it has not been in school. It's been generally family members, parents who are working elsewhere, spouses for our staff. And so the source of the infections have been outside of school. And then the second question we have to answer is, who did the person that's infected come in contact with, close contact with, at school? And so close contact is defined by the CDC as within 6 feet of for more than 15 minutes, even masked, and we have our masks on in schools. So then we dig into the contact tracing. That's how we answer those two questions. Where was the person infected, and who has that person been in contact with in schools? That's the contact tracing we do in close partnership with the City Health Bureau, who are the experts. So far, we're basically at the end of 1 month of school. We started August 31st. We've had 17 positive cases across the district, and then plus 2 students that are in the e-classroom setting, but they haven't been in school at all. Of those 17, 13 are still what's called active, and that means they're still in the 14-day isolation period. And anyone that was identified as a close contact of those cases would then still be quarantined for that 14-day period. We have 13,000 students, a couple thousand employees. So we're talking about 15,000 people directly connected to the schools. So 17 cases is about 1/10 of 1% of the population. So as an example, 1% would be 150 cases. 1/10 of 1% is 17 cases. 11 schools have had a case, and 11 schools have not had a case. Although I'd love for that number to be 0 and any person that has COVID we worry about, I'm told that all of the folks that have contracted those 17 are doing all right. No one's been hospitalized or had very serious conditions. So no case has been contracted in school, we know that, and we have not seen a spread of the virus in school. We know that through our contact tracing. Contact tracing has been, frankly, a lot easier than I anticipated because of having kids in every other day and only having about 40% of the kids in school at any given time has allowed us to have the social distancing. So if you're more than 6 feet, you're not a close contact, and we wear the mask for that extra protection. It's made it easy because I'll give you an example. If a student is identified as positive on Thursday, they haven't been in school Monday, Tuesday, and Wednesday. So we don't have to go through 3 full days of school and review who were their close contacts, who did they eat lunch with, where were they. It's one day, Tuesday. And often the person has been out the whole week that they got tested, so it's even beyond that period that we would really need to focus on close contacts. So the small classes, the distancing, and the every other day schedules, having kids in only 2 days a week, has really made the contact tracing doable, and it also significantly reduced the number of contacts. We've had a number of cases that were no contacts and a number that were just a couple of contacts. We've even gone so far as to check the cameras in the secondary schools. We have cameras in the cafeterias, so we can actually watch the footage and see who the positive student may have been around during lunchtime when people are eating. Even though they're distanced, they do have their masks off, so we wanted to watch that. We check student schedules. We check with the teachers on the student schedules, see what was going on in class, make sure there were no contacts or identify the close contacts there. We also check bus rosters. What days have they ridden the bus? If they're bus riders, what activities are they involved in? So we work our way through the students' life at school to identify any potential close contacts, or the staff member. We do the same type of close contact tracing. I should say, a close contact, the time period is 3 days prior to the first day of onset of symptoms, or 2 days before testing for an asymptomatic person. So we have strict guidelines from the CDC and the health department, and we work with the health department to make sure we follow those very closely. Overall, you know, things have gone well. I'd love to see 0 cases in the school district, but the fact of the matter is there is spread in the community. The virus exists, and with 15,000 students and employees, we're going to have some cases. We will take quick action to close the school at the first site of any spread in school. Again, we haven't had that. We've been fortunate. But if we see that one case is connected to another case in any way, or even if we're not sure, if it looks like it might be connected and we're not sure yet, we'll close for a couple days to straighten that out and figure out was there spread in school or not, and then reopen. And if there is spread in school, we'll be closed for a longer period than that. So I just want to reassure our parents and our community, we're on it. I'm really proud of how our health services department, our school nurses, our supervisor of health services is working hand in glove with the health department and St. Luke's. I speak regularly directly with the director of the health bureau in Bethlehem anytime I have any question about what we should do to make sure we're staying on top of this to keep everyone safe in our schools. We want to be open, but we want to be safe. Thank you.